Welcome back. Today we have psychotherapist Lisa Bahar here, and today we're going to be talking about women and addiction. And obviously with addiction that covers so many different things. Let's start out with drugs and alcohol. What are the primary reasons that women get addicted to drugs and alcohol?
Well, I would say it's probably a lot to do with feelings of emptiness, wanting fulfillment, being loved and accepted, and many times just wanting to escape or numb out from feelings that they don't want to feel.
And are there different challenges that women face with addictions that lead them to addictions? Is it different from men and women?
Well, there's certainly some similarities, but I would have to say some of the differences that I'm noticing with women are self-esteem, body image, self-identity, and issues just relating to self and not really knowing who they are, and looking to drugs and alcohol, for example, to define them.
There's an increase with prescription drug usage. And
Yes.
why do you think that is? Just the access, the commercials on TV? I mean, why do you think that so many more people are abusing prescription drugs than they used to?
Well, you know, it's like what you said. Probably the access, what they see on TV, the more sophisticated kinds of drugs that women are using are bringing them different kinds of high. So there is a tendency to turn to opiates, for example, pain medications, or stimulants to keep their weight down, for example.
And part of it is that, you know, well, I'm not going to a drug dealer. I'm doing, you know, something that's very legal.
Even going to my doctor.
Exactly.
And these doctors are prescribing it. I'm noticing with a lot of the women that are in my community, they're looking for a fix and, you know, this solution or this mask to a problem rather than looking within themselves and saying, you know, what is the cause of this and trying to find a remedy.
Yes. Well, that takes some time, but you're absolutely right. They'll use their physician, not use their physician intentionally, but unconsciously validate the addiction that maybe a professional would assess and go, oh, they're definitely addicted, but the individual doesn't know because in their mind they're rationalizing it through. It's prescribed by a physician. How can this be an addiction?
But that's also giving so much weight to that physician and thinking, okay, well, he would tell me or she would tell me if that was not appropriate. And that's why I think individuals need to take more control of their health and make their own decisions about medications, everything, much more. I mean, get advice from doctors, but really make their own decisions.
Absolutely. An informed medical decision is absolutely important. And doctors will talk to you and ask an individual, how are you using this medication? What exactly is going on with you? It's not that they don't ask necessarily, it's that the client might or the patient might minimize how they're using the medication.
Well, speaking of addictions, you know, obviously there's so many others with shopping and sex addiction, food addiction,
caffeine.
Is big. But is the brain chemistry the same with no matter what the addiction is?
Well, medically, that would probably be a medical doctor's answer, but in answer to your question, from what I know, just treating addiction, is that the primary craving center is pretty much anything that fulfills that particular area of the brain. So it's one area of the brain, and the addiction either numbs that out or gets it high or whatever, but the primary craving center is the same.
And, you know, with women today, I mean, we're feeling so much more empowered and, you know, we're taking on so many different roles. So is part of all of these addictions, I mean, are you seeing a higher number of addictions with women, and is it because of all the stresses we've got going on?
Well, I see a lot of women in general. So what I'm noticing is that the stressors for women are becoming much more intense, if you will. I don't know if that's the exact word, but there is some roles that are shifting. Women are, like you said, you know, the primary breadwinner many times. They're trying to be a mother. They're really trying to fulfill a lot of different kinds of needs, and so the stressors are different. And addiction might be a way to self-calm.
So what could a woman do instead of going to her addiction, be it, you know, a prescription or narcotic, what have you, in that moment of stress? What can we sit back and say to ourselves, or what action step could we take to not go for that addiction?
Wow, that's a great question, and that's a question that we hope that people will ask themselves is, how can I cope with these stressors without turning to a substance or something that's unhealthy? And so that's where coping skills and life skills comes into play, of learning how to self-calm, soothe yourself, bring yourself to a place of relaxation.
Well, Lisa, that was great. We're really going to take some of that to heart. So thank you for being here.
Thank you. Thank you for having me.
All right, and we'll be back with more Every Way Woman.